There are physiological changes that occur in the elderly that affect their appetite and their thirst. And so these are two of the main things that happen with their intakes. And appetite can be impaired by changes in their digestive system, changes in their hormone balance, if they're experiencing pain, if they have a chronic disease. They also have issues with constipation, and they also get a sense of fullness that stays with them longer, so they're not as hungry as they might be otherwise. And then, of course, people can have issues with their dentition. They may have ill-fitting dentures. They may be missing a lot of teeth. They may be having mouth pain. People might have pain or sores in their mouth or tongue from even antibiotic use. That's seen pretty commonly. And so you have all those factors going on. Their mouth is also drier. They don't want to maybe eat as much because, it's just that cottony kind of taste almost they'll express. Crumbly foods or dry foods they especially would want to avoid. Indicators for thirst don't work as well as it does in a younger adult, so a lot of times they don't have that same thirst sensation, and so they don't drink as well. So if people have a lot of arthritis pain or other issues, but especially pain, they might not drink as well because they know if they drink, they're going to have to go to the bathroom. And so therefore, they don't want to have to go through as much movement maybe as they might have when they were younger. So there's all of those situations that go on that affect their intakes. There's also a decreased ability and sometimes just the inability to be able to feed oneself. And this can be the result of Parkinson's. It can result just, tremors from unknown sources or origins, and then just maybe limited mobility. Maybe they've got such bad arthritis in their shoulder that maybe just even lifting their arm to be able to reach and do that food motion is painful for them. Assistance is needed in those individuals to help them eat. They may just need assistance with getting the utensil in their hand properly. Sometimes people will do hand over hand motion and put their hand on theirs to get the food from the plate, to their mouth. They may lose food from the plate, drop it out of the utensil or lose it in the utensil. And so they may need adaptive equipment. Occupational therapists work with patients a lot of times to help them as far as either giving them built-up utensils. If they have a trimmer or weighted utensil, sometimes will help reduce that trimmer to where they can actually still feed themselves. If it's the actual motion of getting the food on the utensil itself, you can use a plate that has a built-up edge so that they have something to scoot that food up against to get it on the utensil, and that will help them a lot. We use divided plates so that foods are kind of segregated so they can just get it on the utensil easier. They might not recognize the utensils. They might not know what to do with them. Sometimes you'll see residents picking up a straw and trying to eat with the straw or eat with their knife. So that's very common behavior when they're trying to do self-feeding. Problems swallowing are a very common problem in those with dementia and the elderly. It can be a result of disease process such as Parkinson's or from a stroke, and sometimes it's just the effect of just the aging process. And so if the person's having problems swallowing, which is called dysphagia, and that is anything that involves that process of from the time it enters your mouth basically and then goes to your stomach, then that's often seen with issues like coughing or choking, and those are the more obvious ones. There's also some that we consider what's called silent aspiration, and that can be things like tears streaming from their eyes or their nose running. So if you're seeing any of those signs in an individual, then that's an indication that they're having problems swallowing. With dementia, a lot of times they're not able to communicate really what their situation is. So if they're experiencing problems with mouth pain or just some kind of issue in their mouth, whether it be the chewing or actual pain, you just have to really observe them and just look for signs of pain. There may be facial grimacing, or you may see them put their hand up to their face. And so that can be an indication that there may be some issue with their ability to either chew or an indication that they've got some kind of sore in their mouth or on their tongue. So that's something that can be checked out. Some of the sensory risk factors as we age, of course, are your sense of smell, your taste perception, and your vision. Those all affect how much you desire to eat. And so those all decrease with aging. And there's a lot of medications that can affect the taste sensation. And so if those medications cause your mouth to be bitter tasting or metallic tasting, then that causes you to not want to eat or drink as well. I have a friend who just recently went through radiation treatment, and she now has a metallic taste in her mouth all the time. And so she used to love to drink coffee, and now she doesn't care for it at all because it doesn't taste the same to her. So these things happen to the elderly as well. They have a change in that taste sensation. So they'll say, food just doesn't taste the way that I remember it tasting. And that really is true for them, because as we age, we lose some of those taste buds. We lose the sweet and salty, but tend to keep the sour and bitter more. And of course, if there's visual problems, again, we use the color plates sometimes just to help distinguish and contrast between where the food item is located on the plate so that they can see it better and be able to get it to their mouth effectively. That will help maybe stimulate their appetite some too if they see that color with their food on that plate. It might help to use a bigger bowl spoon so that they have a bigger surface to get the food on, or just use a spoon to eat with, because that's usually easier to keep the food on a spoon bowl than it is to try to use fork tines to pierce the food. Sometimes they can't find food with a fork. If their vision is just really bad enough, you may need to feed an individual. If a person still has their cognitive ability to know what a clock is, you can also tell them where food is located based on the time on a clock, like your meat's at 6 o'clock, your mashed potatoes are between 12 and 2, that sort of thing, so that they can visualize where those items are, and then actually maybe have them place their hand on their beverage item so that they know where that's located in relation to the plate. So that's used a lot of times with people who have visual issues. But if you're assisting a resident that is hard of hearing or has difficulty understanding what you're saying to them, then they may not understand what you're telling them about the food. So, it's important, if they do have hearing aids, that they be worn during meal times so that they can understand hopefully what's being said to them and know what the caregiver's informing them of as far as telling them about food items or asking them about a choice. And if you ask a person a choice and they just kind of stare at you, then maybe there are some issues with their hearing, and that's something that needs to be looked into. Cognitive impairment, that affects a person's memory and the ability to recognize certain things. There's issues with not just really knowing what things are. They don't recognize what food is, and they may lose their abilities in dealing with food. They may not be able to feed themselves. They may not be able to handle the utensils. They may not be able to just even know what is food and what isn't food. So you have to be careful to make sure that they don't start eating inedible items. Sometimes we find people who have like straws on their tray will try to eat the paper from the straw or try to eat their napkin. Their perception of what is food and what isn't food is lost. Their perception of time is distorted or gone. So they don't really know, okay, this is the start of the day, it's time for breakfast. It's good to reinforce those things, to state to them, good morning, you ready to eat breakfast, or let's go eat breakfast, that sort of thing. And so because of their perception of time, they may not remember if they ate, they may not remember to eat. Even if they have eaten, they may come back later and say, I didn't eat, even though you know that they did. And just the best way to handle that is to not argue with them or put up a fight or anything, but just say, okay, well, let's get you something to eat, and then give them a food item. And even if they're up just walking around, you could give them a finger food item or a snack type item that they could take with them as they walk and consume. You just have to be very aware of, do they actually know how to eat or that it's time to eat, and then just help them with that perception of time.